Hi, my name is Martha Wittenberg. I'm a physician at the Institute for Progressive Medicine. I've been a doctor for 20 years. Initially, I did a residency in family medicine, and then I subsequently did a fellowship in integrative medicine. I've been practicing hormone replacement therapy for about 10 years and have been practicing pellet therapy for 6. So today we're going to talk about hormone replacement therapy. Hormone replacement therapy is restoring hormones that are low or imbalanced. The most effective treatment is the pellets because they're more physiologic. So when you're resting, you don't release as much of the hormone into the bloodstream, and when you're up and you're active, you tend to release more. So that tends to be the most effective, and we see the best results with that. Pellets are little tablets that look like a little grain of rice placed under the skin in the upper outer buttocks area. After we clean the area, we do inject lidocaine into the area so the patient doesn't feel any discomfort during the procedure. And it just requires a very small incision that we close with steri strips, so no sutures required. Typically, people can resume their normal activity after 3 days. We recommend that they not take a bath or a hot tub or a pool or do anything for the first week that could potentially infect the incision. We want them to avoid any vigorous lower body exercises for 3 to 7 days. The steri strips stay on for about a week, after which the incision should be well healed. And then within a week or two, the effects of the hormones are felt by the patient, and they start to feel a lot better pretty quickly. And then the pellets can last approximately 3 to 4 months in women and up to 6 months in men. But the actual procedure only takes a couple minutes, and then we bandage the patient and give them an ice pack to prevent the bruising and the swelling. So anybody interested in any of these services or procedures, please call our office at 949-600-5100 for more information.